Liver cancer is a type of cancer that originates in the liver. The most common form is hepatocellular carcinoma (HCC), which starts in the liver cells. Other types include cholangiocarcinoma, bile duct cancer, and angiosarcoma, the rare cancer of the blood vessels in the liver. Risk factors: several factors increase the risk of developing liver cancer. Chronic viral hepatitis, hepatitis B and C infections are major risk factors. Chronic infection can lead to liver cirrhosis and increase the likelihood of liver cancer. Cirrhosis, chronic liver damage from any cause, such as alcohol abuse or non-alcoholic fatty liver disease, can lead to cirrhosis, which significantly raises the risk of liver cancer. Alcohol consumption, long-term, excessive alcohol consumption can lead to cirrhosis and increase cancer risk. Non-alcoholic fatty liver disease (NAFLD). Obesity and diabetes can contribute to NAFLD, which may progress to cirrhosis and liver cancer. Aflatoxin exposure. Aflatoxins are toxic compounds produced by certain fungi that can contaminate food. Long-term exposure can increase the risk of liver cancer. Genetic conditions. Certain inherited conditions, such as hemochromatosis, iron overload, and Wilson's disease copper accumulation, can increase cancer risk. Type 2 diabetes. Diabetes can contribute to liver disease and increase the risk of liver cancer. Obesity. Obesity is associated with liver disease and increases the risk of liver cancer. Symptoms: liver cancer may not present symptoms in the early stages, but as the disease progresses, symptoms may include abdominal pain, often in the upper right side of the abdomen. Weight loss, unexplained and often significant weight loss. Loss of appetite, decreased desire to eat. Nausea and vomiting, persistent nausea and occasional vomiting. Jaundice, yellowing of the skin and eyes, indicating liver dysfunction. Swelling, abdominal swelling or bloating due to fluid buildup ascites. Itching, generalized itching of the skin. Fatigue, persistent tiredness or weakness. Fever, low-grade fever may occur. Enlarged liver or spleen, detection of an enlarged liver or spleen during physical examination. Diagnosis: to diagnose liver cancer, several methods may be used. Medical history and physical examination. A thorough review of medical history, risk factors, and physical examination. Blood tests. Liver function tests, assess liver health and function. Alpha-fetoprotein (AFP) elevated levels can be indicative of liver cancer, though not exclusively. Imaging tests. Ultrasound, often the first test used to detect liver abnormalities. CT scan computed tomography provides detailed cross-sectional images of the liver and helps in staging the cancer. MRI magnetic resonance imaging offers detailed images and is useful for assessing the extent of liver involvement. PET scan positron emission tomography may be used to evaluate cancer spread. Liver biopsy. The sample of liver tissue is taken to confirm the presence of cancer cells. This can be done through percutaneous biopsy, needle through the skin, endoscopic biopsy, or during surgery. Genetic and molecular testing. Testing of the cancer tissue may be performed to identify specific genetic mutations or markers that could guide treatment. Treatment options depend on the stage of cancer, liver function, and overall health. Surgery. Partial hepatectomy, removal of a portion of the liver affected by cancer. Liver transplant, replacing the diseased liver with a healthy one from a donor. This may be an option if the cancer is confined to the liver and certain criteria are met. Ablation therapy. Radiofrequency ablation (RFA) uses heat to destroy cancer cells. Microwave ablation uses microwave energy to destroy cancerous tissue. Cryoablation uses extreme cold to destroy cancer cells. Embolization therapy. Transarterial chemoembolization delivers chemotherapy directly to the tumor and blocks its blood supply. Transarterial radioembolization. TARE delivers radioactive particles to the tumor through the blood supply. Radiation therapy uses high-energy radiation to target and kill cancer cells. Often used when surgery is not an option. Targeted therapy uses drugs that specifically target cancer cells with particular genetic mutations or pathways. Immunotherapy stimulates the body's immune system to fight cancer. This may be considered in certain cases, especially with newer therapies. Chemotherapy uses drugs to kill cancer cells, often used in advanced cases or when other treatments are not effective. Prevention. Preventing liver cancer involves addressing risk factors. Vaccination. Hepatitis B vaccine can prevent hepatitis B infection, a major risk factor for liver cancer. Screening. Regular screening for liver cancer in individuals with chronic hepatitis or cirrhosis may lead to early detection. Healthy lifestyle. Maintain a healthy weight, manage diabetes, limit alcohol consumption, and avoid exposure to aflatoxins. Medical management. Manage chronic liver diseases and conditions like hepatitis or cirrhosis to reduce cancer risk. When to see a doctor if you have symptoms suggestive of liver cancer or have risk factors for the disease. If you have chronic liver disease or hepatitis and experience new or worsening symptoms. For regular monitoring if you have cirrhosis or other liver conditions. Prognosis. The prognosis for liver cancer depends on the stage at diagnosis, the extent of liver involvement, and the patient's overall health. Early-stage liver cancer has a better prognosis, especially with surgical options or liver transplant. Advanced liver cancer may have a poorer prognosis, but treatments can help manage symptoms and improve quality of life.